Hi, my name is Brianna and I work as a psychiatric technician. Being a psychiatric technician, basically, you're working with patients who have been a threat to society or to themselves. Perhaps they mentioned to someone that they wanted to kill themselves, or they had intentions on hurting someone else. And therefore they would be put in a unit as far as and a psychiatric technician would be watching over them and working along with the nurses and other qualified mental health professionals. I would say there's different types of units when you're working with mentally health patients or mentally ill patients. There are, where I work, there is a unit for children. There's a unit for women and also a unit for men. The duties entail, as far as working as a psychiatric technician, you're making rounds, you're checking on all the patients every 15 minutes. You're observing any changes in their behavior and any changes in their appearance. Perhaps we have a patient who is getting very anxious when they're running up and down the halls or restless and pacing, and that those types of notations or those types of behavior need to be noted, and the doctor needs to be aware of that, as well as the nurses, so that they can make the necessary changes in their medication, perhaps, or any other type of therapy that needs to go on for those patients. We also have an open unit and a closed unit. The closed unit would be the patients that are more severe. Our open unit would be, the less severe patients, and duties entail, as far as taking them down for outside and to the cafeteria to eat. Those are some things that psychiatric technicians do. Also, group therapy. We help along with that, sitting in the group community meetings with all the patients, and just, as well as just still observing their behaviors and making the necessary notations in their charts for that. If a patient becomes angry, or if a patient is intrusive and is, seem very strange acting, we need to make sure that we tell the doctors and the nurses, so they're informed of that information. I would say the stress level would be, it can be very high, but it can also be, a pretty normal job, pretty average. As far as job requirements, my employer requires only a high school diploma or GED, along with other valuable experience within education experience. Many people who get into this field of work, as far as the psychiatric technician, they are working on higher degrees. As far as any health field, nursing, any graduate programs, as far as psychology, school psychology, mental health counseling. Being a psychiatric technician is a great entry-level position within those fields, those career fields. As far as skills needed to perform as a psychiatric technician, I think the greatest or the most valuable skill that you are going to need is to be able to communicate efficiently, being able to communicate and deal with patients that are depressed, patients that are lonely, patients that are scared. And by helping these patients and being able to communicate properly and listen, you're able to de-escalate their situations. The best part of working as a psychiatric technician would be being able to see the patients when they're leaving the facility, being able to see a difference, a difference in appearance, a difference in how they're being able to function, knowing that they've been taking their medications properly, and they're leaving with their family on a wonderful note, or with leaving with their friend, and they're able to function within society. The worst part as a psychiatric technician, I would say, when we experience codes. And codes, or a code, which would be like a code gray, basically a violent situation. Sometimes, we experience this when a patient refuses to take their medications properly, and they become violent, or they don't want to do something that we ask them to do, as far as eating properly. Some don't want to eat. Some don't want to have liquids. They don't want to hydrate themselves as far as drinking water, things of that sort, and that may erupt into a situation as far as a code gray. In that case, we would have to ask for other staff members, and this may entail restraining the patients, and where we have to actually do hands-on, and put them in the quiet room and use restraints on their hands or on their feet, and that would be the worst part of our job. My final advice for someone that is interested in this career field, I would advise you to consider this position as a great way to get into other career fields, as far as psychology or any other health-related field. And I would, advise you to start observing human behaviors around you. Observe your friends and your families, and the reason why they do what they do.